All right, so we got Dr. MJ Collier on with us this morning. The time right now is 15 before the top of the hour. Dr. MJ Collier, good morning. Thank you again for joining us, man, and waking up extra early. How many hours did you work yesterday?
Oh, I finally finished about 8 o'clock last night. So,
okay, that's getting off early for you.
Yeah, that was a busy day yesterday, though. It wasn't just the time; it was just the volume. So, we're having more people coming in. There was a surge in testing in the last 2 days. I'm not quite sure why, but also a lot of positives. So this is out there, and people need to understand that this is real. Nothing has changed other than the time that we've spent dealing with this. So good morning, Rickey, and good morning to all the Rickey Smiley Morning Show listeners.
Good morning to you,
Brad, Special K, and everybody. Now, let's go over the stats once again. The United States is now at 850,000 cases. I think we're going to break 1 million, possibly, definitely no later than Monday. 48,000 deaths, 85,000 recovered. In Georgia, which will be opening up tomorrow, the number of cases has increased from 20,000 at the beginning of the week to 21,100. Well, not beginning of the week, 3 days ago, on Tuesday. So, and death rate has increased from 818 to 846. So the disease state marches on. But Rickey, one of the things that we have found is that, I want to reiterate, because it's going to open up in Atlanta, Leeds, that people need to be aware of what the symptoms are once again. So if you're going to go out and get a haircut or get a tattoo or get your toes and nails done, these are the things you need to be aware of about the people around you and the people that are providing your service. The symptoms are sore throat, body aches, dry cough, fever. Remember, we added to that pink eye or conjunctivitis, nausea and vomiting or diarrhea. But guess what? People can have all of those symptoms, or people can have none of those symptoms and be an asymptomatic carrier, putting you at high risk for this disease state. Also, Rickey, yesterday in Atlanta, the big hospital in downtown Atlanta, the big private hospital is Emory Midtown. Emory Midtown had to close their ICU yesterday because staff members tested positive for the coronavirus. So they closed that unit down. They did successfully transition other space into the hospital into a new and different ICU with different staff members. But that just goes to show you that no matter what, and this is not the ICU where they were treating the coronavirus patients. That is a special ICU where people are tested positive. This was the traditional ICU for cardiovascular disease, heart attack, strokes, and other life-threatening disease states. And what happened was that somebody brought it in there, or one of the patients or one of the staff. But once they found staff members had been infected with the coronavirus, they closed it down. So even in the hospitals, even a matter of fact, they told you if you get sick, don't go to the hospital, because if you don't have it, you probably will by the time you leave out of there. So
Dr. Carl, I just wish I could see it. It's just got to be floating in the air.
If there was some magical spray that you could spray it turned purple or something, you could use a special light like they do, when they're looking at bed sheets in hotels and everything. That would be great. But unfortunately, that doesn't exist. So we have to assume, just like when HIV was first brought to the community, you had to assume that everybody had it, and you had to protect yourself from everybody. Well, you have to presume now that everybody is a potential coronavirus victim or carrier, and you have to protect yourself from everybody. Otherwise, this is going to spread. Now, Georgia is going to open up tomorrow. Amazingly enough, even the president said he thought it was too early. Public health officials have said that Georgia should not consider it before their peak has been on the downslope, and that date would probably be about June 8th. And so we are 2 to 3 weeks before that. No, I'm sorry. That would be May. So we're 6 weeks before that, and yet we're opening too early. So even the president said that, but I think there was kind of 1 degree of separation. So if it goes badly, he can claim that he said not to do it. And if it goes well, he can say, yes, I emphasize that Georgia took the lead and did well. And, and again, Atlanta leads. When people say Georgia, people think Atlanta. And so there'll be other places that aren't officially open, but they'll say, hey, in Atlanta, they're doing all of these things, so I'm now going to go out and do these businesses. And even in Las Vegas now, they're thinking about opening up casinos again. So, this is going to be amazing. 2 weeks, everybody's going to say, wow, this is great. We opened up. Business is booming again. And then after that, the number of cases will go up, and probably about 2 weeks after that, the death rate is going to skyrocket. So, Ricky, we're going to have a problem. We're really going to have a lot to talk about during that period of time, because we would have literally wasted all of this time, sheltering in place, staying at home, and self-quarantining. And all we would have done was delay the inevitable and basically, let our hair grow out and let our hair turn gray. That, so nothing would have been accomplished of substance. We would be right back where we were, possibly even worse, because people, I understand, they've grown fatigued with coronavirus. They are tired of doing as much nothing as possible. They want to get out. They want their lives back. They want to resume some semblance of normal. People are really starting to have financial and economic issues now. We said that after the 1st of April, when bills became due, it would be stressful. And after April 15th, when bills became late, it would be very stressful. And now, people are running out of money, and they don't have resources that they can get it, because nobody they know has money. So they can't borrow from friends and family. And, the traditional sources for people of color, we borrow from friends and family. We don't pay it back, but we borrow from friends and family. So that's where we are.
Well, Dr. Collier, let everybody know how you can be reached.
Okay, that's Ask Dr. MJ. That is now also linked to my personal website. So we have the website for Atlanta West Primary Care, Dr. MJ Collier. We have lipodrops.com. Go to lipodrops and find out how to boost your immune system. Because if you didn't need it before, when you were self-quarantining, you're definitely going to need to boost your immune system now. And through the next segment, we're going to talk about how to do that, Ricky.
All right, Dr. MJ Collier, y'all, more Rickey Smiley Morning Show coming up.
Rickey Smiley.